May 30th marked the opening of the first PKD clinic in Surrey BC. Dr. Mike Bevilacqua was on hand to talk PKD 101 with our plugged-in reporter, Deb Tucker.
In layman's terms, can you describe what polycystic kidney disease, or PKD, means?
Sure. So your kidneys, just to start at the very beginning, are organs that are kind of within your abdomen. Each one's about the size of your fist, and they just kind of happily sit back there. What polycystic disease means is that these kidneys tend to develop many little pockets that we call cysts. They're basically bubbles of fluid. People are allowed to have one or two or a couple of these things, and that can be quite normal, but having many of them, that's where the word polycystic comes from. It's a disease of many cysts of the kidneys. And eventually what happens is these cysts tend to get bigger and bigger and bigger as they fill with fluid. The whole kidneys kind of expand as that happens, and eventually those pockets of fluid impact the kidney's ability to do its job. Those jobs of cleaning the toxins out of the blood and things like that. And that's when it eventually has an impact on people's kidney function. There are other parts of the body that are affected in people living with polycystic disease, so it's not just a kidney disease, but that's the main organ that's involved.
Okay. Can you tell me who is affected by PKD?
Many people is the short answer. So people tend to think of diseases as being, genetic diseases as being quite rare, but polycystic kidney disease is actually the most common genetic kidney disease in the world. We see that here in Canada, and we see that everywhere in the world. In BC, if we had to estimate, we'd say there's probably up to 10,000 people living with polycystic disease. So many people are affected by it. One of the things I didn't say earlier, it's a genetic condition, so it's a disease that can be passed down through families. So you can have families where many individuals are living with this disease.
But any person can get it.
Any person. So one of the things that's unique to polycystic disease amongst genetic diseases is that any racial group, any country in the world, anywhere you go, you will see PKD in similar values. Some other genetic diseases are only found in certain pockets or places in the world. Anywhere in the world that you go, you will see polycystic disease.
What are the symptoms of PKD?
A lot of people start to have symptoms as the disease goes forward. So you have to remember that being a genetic disease, this really is a lifelong disease. So early on, the symptoms are nothing. People, could live many years of their life before they start to feel anything, especially with the dominant form. People often are well into adulthood before they even know that they have the condition. But then the symptoms start to come up as the kidneys eventually get bigger. So as those pockets of cysts get bigger and bigger and bigger, the size of the kidneys starts to give people symptoms. People can feel fullness and bloating and actually start to notice their abdomen getting bigger. Sometimes we have men are told that they have a beer belly, or women are asked if they're pregnant, and it's just from the size of the organs that are within there that are making them get bigger. So obviously that can start to have some symptoms. The cysts themselves sometimes can unfortunately even rupture. It's a little bit more complicated, but you can almost think like a balloon popping, that if it gets bigger, it can rupture and things happen, like people can have blood in their urine, they can have pain from that. And there are these organs can be prone to things like infections and kidney stones. So unfortunately, there's many different symptoms that can come along with this. And those symptoms can happen at different parts of the disease. It tends to generally be that as people advance more, they get more symptoms, but it's quite variable. And then ultimately, those are the symptoms that come up just from the kidneys themselves. Ultimately, the kidney function starts to go down, and then people start to have some of those same symptoms of kidney failure that anybody else with kidney disease would have, but that's very late in the disease course.